Anxiety is the most common type of mental health disorder and it has a lot of types. But in this video, we'll talk about the basic one. In simple words, anxiety is characterized by feelings of fear and excess worry, which are strong enough to interfere with one's daily life. It can also be a symptom of an underlying medical condition such as overactive thyroid or low vitamin B12 levels. There are a lot of symptoms of anxiety and they vary from person to person, but the most common ones are a rapid heart rate, dizziness, headaches and tremors, and sweating. As I mentioned earlier, that anxiety can be a symptom of an underlying medical condition, so we need to look out for that first. After that, going for a psycho-evaluation is the topmost recommendation, but here are some major signs that you may have anxiety. Okay, so for this, all you need is a notebook and a pen. Observe yourself for a day and look out that how much time you spend worrying about things. Do you worry about minor things that are not even important to you, or you keep thinking about the past or the future? And if you spend a lot of time doing all this, it's a sign that you may have anxiety. Feelings of restlessness is also a sign. If you feel restless after being productive throughout the day and doing all your work, but you have that feeling of incompleteness, it's also a sign. Do you have a lot of fear? Do you avoid situations and social gatherings just because you think that you might get into trouble? You can also take a quiz to find out more. The link is in the description. Anxiety has a lot of reasons like childhood trauma, negative life events, but the exact cause of anxiety is still unknown. A lot of people don't even know why they are having anxiety and they have out of blue panic attacks, which is like the extreme form of anxiety. People with anxiety have a sensitive amygdala, which is the emotional part of the brain, and it plays a key role in processing threat and fear perception. It activates the flight or fight response without taking any initiative from you. Berhal, the most effective form of treatment for anxiety till date is medication and therapy. But you have to understand that anxiety is much more about how to experience anxiety. There is a great example in this book called Why Has Nobody Told Me This Before by Dr. Julie Smith, in which she explains to fight your fear, you must be willing to face it, and fear is a part of our survival response. The first part of healing is to get your life back on track. People with anxiety have a bad schedule. They have a terrible sleeping schedule. They sleep at 2 and wake up at 10 in the morning. So fix your life first. Take a notebook and a pen, write down your goals, and give your brain no time to feel all that. But anxiety can also appear as laziness, but small steps every day can also help. Staying busy with the things you love will heal your inner child, and use positive self talk instead of talking crap to yourself. The best thing you can do if you have anxiety is CBT, which is a cognitive behavioral therapy. It's a form of treatment approach that helps you identify unhelpful thought and behavioral patterns. It helps you identify the ways your thoughts and emotions can affect your actions. When you understand it fully, you learn new coping strategies and you can change your behavior after that. There are also a lot of rituals that you can do to enhance your mental health. I have made a video on that. You can check it out as well. Creating an action plan will make a way out and you will eventually feel better.